Good afternoon, ladies and gentlemen. Dr. James Lyons Weiler coming to you from the WWDNYK studios in Pittsburgh, Pennsylvania. Today, we have a little bit of a thunderstorm here, which means you might hear a little background knowledge. We're not in any way indemnified from background knowledge, background noise here. Nevertheless, today we have super guy, absolute wonderful, good human being, strong man, good dad, Dr. Jim Meehan. Always a pleasure to have him, talk to him under any circumstances. Welcome, Jim.
Oh, it's great to be here. Thank you for the kind words.
Right on. So there was a bit of a kerfuffle online. You made some outrageous allegations about masks and how they're not useful in the general public and what the actual biological and medical effects of masks might be. You have provoked some criticism. And so why don't we start from the beginning? If I've got a cloth mask and the CDC tells me to put the cloth mask on and I put it on in the morning and I take it off at night, what have I just done to myself?
Well, you've done very little than kind of symbolize your submission to bad science. So it's about time we unbreak that science, because there's a huge body of science that we've been looking at for 20, 30 plus years in relation to the influenza virus. There's a reason why we have never recommended masks for the population to mitigate the transmission of a seasonal flu virus that many times reaches epidemic levels, levels often that exceed anything that we've seen even in COVID-19. I'm a survivor of the 1968 Hong Kong flu pandemic. My mom and I both got it. There were, millions of cases across the United States and about 300,000 deaths. We've never recommended masks to mitigate viruses because they don't work, and that's what the science says. The highest level of science that we should be looking to are meta-analysis of multiple randomized controlled trials. So we know that randomized controlled trials are really the only way to make a really sound decision. It's the epitome of the scientific method, and yet we don't use that science very often in many of these cases in medicine. But we do have those studies in terms of influenza viruses and even measles viruses, and that those multiple meta-analyses of influenza transmission in healthcare workers and in healthcare setting have consistently said that masking really has no effect in preventing transmission. A 2015 study on cloth masks said they're absolutely ineffective and should not be recommended over real medical masking. And what real medical masking really means is that we probably need to use at least an N95 respirator. And quite honestly, depending on the nature of the virus, that's not enough it's still not going to block enough of the virus. I'm going to wear a PAPR. I'm going to wear a powered personal respiratory device that's completely sealed and has its own air supply.
You can get those at Dollar General, right? You can pick any there. You can pick those up at Dollar General anywhere, right? Those.
Well, no, I'm talking about like
I'm being
what you see on.
I'm being facetious.
Oh yeah, right. Sorry, yeah.
The American public can just get it at 7-Eleven. Go down and get one of these medical powered. Because you don't want to rebreathe your oxygen. You don't want to rebreathe your CO2, right? So you've got to power that stuff. So here's what I want to. We're at a point now where most of the people that listen and are in on the conversation are aware of the differences between cloth masks and the medical masks and so on. And we're starting to see studies beyond just the fact that we know that in cloth masks are not useful in a healthcare setting compared to real medical masks. We know that cloth masks are going to do basically nothing in public if you're already social distancing. But what people don't necessarily understand yet is that there are risks associated with, you mentioned that you're going to do something to make sure you can block the virus. CDC says at one point in time, they said that you have to have 16 layers of cloth. They put up instructions where you're supposed to wrap your head like a mummy 16 times around, and people are going like this and going into, this, I'm good, right? I'm good now.
Yeah.
This is fine, right? So what are the risks of wearing masks? Well, when you're in a medical center and you're a surgeon or just wearing masks to protect yourself, if you're talking with a patient who has a communicable disease, especially a virus. About how long does a medical person typically wear their gear?
Well, that's a great question. That's a critical question to understand. It's a very short period of time, even in a surgical operating suite where we have extreme air exchange conditions. The temperature is lower. There's a higher concentration of oxygen in the room. We're filtering. There's very significant filtration systems that filter out any potential infectious material. So even in that environment, I've done over 10,000 surgeries wearing a surgical mask. In the longer surgeries, anything over 30 minutes, I often have to change my mask, even in that optimal environment for, decreasing my perspiration, decreasing the amount of moisture retention in the mask. The effects of, and this has been studied in surgeons, the effect of the mask blocking our airflow, decreasing arterial oxygen levels, rebreathing CO2. Those effects have a physiologic response. They would start to induce a tremor. I'm an eye surgeon, so I do fine detail microscopic work under a microscope, and the tremor is significant. When you start to change your arterial gas levels, it alters the physiology. Often long surgeries get a headache from having to rebreathe my own breath. That's we're designed to exhale these materials, not re-inhale them. So about 30 minutes in an optimal environment. Now, in my office, I've had several restaurant managers in the last couple of weeks that have come in and said, my employees are dropping out. They're complaining of headaches. One of them even bought her own CO2 monitor. We have one as well. And they did the study, the little test that Dell demonstrated on his own son on the high wire, showing that in about 35 seconds, we repeated those with my own meter here in the office. Within about 35 seconds, when you place the monitoring tip of the CO2 monitor behind the mask, it maxes out at 9,999 parts per million of CO2.
Wow.
Now, OSHA regulations, Occupational Safety Health Administration regulations, say that anything over 1,000 parts per million of CO2 in your environment is a significant medical concern. We're talking about in 35 seconds while wearing a mask, even a cloth mask, you're increasing your environmental exposure to CO2 by 5 to 10 times.
Yeah, that's unfortunate. We have a lot of people in workplaces that are being forced to wear masks for long periods of time. And, I would certainly hope that businesses would start to wake up to it's not just the risks of the mask, but there's also low transmissibility of coronavirus. In spite of the fact that 100 and something scientists came out and said, yeah, well, this is probably aerosolized. Beyond the human immune system, most of the time being able to take care of it, and the fact that we have cross protection from prior exposure to, most of us are probably already immune. That's why we have no effect of this. You're asymptomatic to something that you're carrying. Like if you had measles as a child, you still get measles infection. You could potentially still transmit measles if you get a replication. So the differences, people need to understand the differences between a virus being present in your nasal tract, nasopharyngeal tract, and infection, and the differences between infection and disease. And
that's right.
These are huge differences, and our policies don't distinguish between them. Our medical practice doesn't distinguish between them. They're counting number of positive cases as coronavirus cases. If you test positive, you have the disease, and that's not correct. That's totally backwards, right?
That's right. Do you believe those numbers, James?
Oh, hell no. No. I mean, from the perspective that, no, I might. If you think about it, if 80 or 90% of us are already immune, they might already have it. They could be walking around with it, right? So the numbers could be huge, and we could still not be worried. Canada, there's this province in Canada that saw 3 times a tripling of the number of cases of testing positive, and the doctors there said, "Don't worry about it. It's just a molecular diagnostic test. It's not like people are dropping dead."
I don't think anybody can really trust the case reports right now. We know that they've been inflated, conflated by the way that we've been multiply counting, tests as individual case reports. Somebody that gets quarantined, they may get 3 or 4 or 6 tests during the period of that quarantine. Yeah. And every one of those in Oklahoma, and according to some of the recent CDC exposure, each one of those 6 tests, 3 tests, whatever it might be, are being counted as an individual case report. The only number that I really trust, and I can't even entrust that number that much, is case fatalities. Case fatalities are a lot harder for them to kind of fabricate, exaggerate, or inflate. And those numbers are going down. So, that's a critical number. Although, there are reports everywhere. We've had them here in Tulsa, Oklahoma. People, a guy was recently shot and was reported as being a COVID-19 death. Because he had COVID-19 at the time of his death. I kid you not. And those stories are everywhere. So even the COVID-19 case fatality reports are inaccurate. But you mentioned something about policy, and I want to, when we come down to this whole mask issue, we're wanting to mandate, and they just recently did here in Tulsa, mandated a medical intervention without any oversight or any kind of training and policy. This is a medical procedure. We should have at least adopted the Occupational Safety Health Administration's policies, which for wearing a mask on your job, right? So those policies say you should have a medical examination. You should be screened for all of those medical diseases, COPD, asthma, silicosis, pulmonary fibrosis. There's so many medical conditions.
Cardiovascular, sure.
Cardiovascular. I mean, yeah, you start dropping out your arterial oxygen in somebody that has a cardiovascular disease, you start depriving the heart muscle of adequate oxygen levels. And we may be causing, so much harm to people that there's I would argue there's no benefit to wearing a mask. Even if you perceive that there is one, if it makes you feel safer, the risks are something that are simply not being discussed. They're not being screened for. We don't know what people are going to get a mask that's going to make their medical condition worse. And we're certainly not talking about the real risks of wearing a mask. And you and I have talked before about this furin cleavage site that's in this SARS-CoV-2, which means one of the features of that furin cleavage domain is that at lower oxygen levels in the bloodstream, that furin cleavage site activates and increases the infectivity of SARS-CoV-2. So my biggest concern, now that the cat's completely out of the bag, that this virus is transmitting rapidly throughout the population, you are going to have a lot of people that have asymptomatic or mild diseases, and you're going to do the worst thing that you could possibly do. You're going to slap a mask on their face. You're going to trap those viral particles that would otherwise be dropping within 3 feet of the individual. You're going to trap them on the inside of the mask, and you're going to force them to rebreathe viral particles. Exactly what you said a few seconds ago, which is you're going to increase their viral load. You're going to increase the infectivity of that virus because you're also lowering their arterial oxygen. You're going to turn an asymptomatic case into a worse case and potentially a lethal case. That's a critical factor that nobody is at it. They're not thinking through the scientific process. They're not thinking through that unbreaking science process.
Yeah, but are they? That's the question. Are they? Are they intentionally driving it up? And I actually wrote a blog article, and I went there, jameslyonsweather.com. I'm going to pull up the title because it's fascinating that you bring all those specific physiological mechanisms. Obviously, if you're breathing your CO2, and you're going to be rebreathing the viral particles. But the title of the report is CDC's policies on masking actually increase COVID-19 risk. Why do you still trust them? And they're going to blame anti-vaxxers, going to blame vaccine risk aware, they're going to blame anti-maskers and so on. But at some point in time, the American public has to wake up and say, what did CDC do with the billions of dollars for a Zika vaccine that we're never going to get?
That's right.
What did NIAID do with the billions of dollars, right? And what over and over and over again, we're told these just so stories that don't match when the policy doesn't match science. That's when I call out my
right. Well, we do know where some of those dollars went from the National Institute for Allergy and Infectious Disease, don't we, Jack?
Yeah,
we know
absolutely.
that $7.4 million went to the Wuhan Institute of Virology to fund the gain of function research that was being conducted at the same lab from which this virus is thought to have emerged. Anthony Fauci spent $7.4 million of taxpayers' funds to fund that research that would be illegal and unethical in the United States. And so that's where some of that money went. But totally. Yeah, and as far as trusting the CDC and our public health authorities, how can you? I mean, they've told us, they flip-flopped and changed their story so many times throughout this pandemic.
That's right.
First week, in February, we were being told by everybody, oh, don't wear a mask. I mean, our Surgeon General even said, stop, don't be silly, people. Stop buying masks. They won't work to protect or block the coronavirus. So stop wearing masks. Fauci said the same thing. CDC said the same thing. World Health Organization said the same thing. Why did they change their views? Why did they change their story? Because the science didn't change. I've looked through hundreds of studies now. There was no new, randomized controlled trials. There were no meta-analysis. There has been one systemic analysis, and that systemic analysis said, guess what? Masks aren't effective. So the only science that of the highest caliber that we have continues to say masks are ineffective. And, again, coming back to this idea that we're talking about, politicizing a medical intervention. What else do we do that for? We do that for vaccines too, but that's a whole nother story. But, they want to mandate a medical intervention. They don't have the proper oversight. They've never trained the public in the proper use and sterile management and handling of this medical intervention. And we're not being honest in the informed consent process. Informed consent is about risks, benefits, and alternatives. Well, what are the benefits? There aren't many. What are the risks? There's a lot. The risk to benefit ratio is completely out of proportion here, but nobody's talking about that.
Agreed. So let's talk about what's missing here. Bernadette brought up this great question. Bernadette Pager, 2 days ago. I've been doing this podcast 3 days in a row. Yeah, she's a brilliant mind. Where does the liability fall? If you fall into something at work because you pass out and you're killed or injured, and you were wearing a mask, and we could trace it to a loss of consciousness for no other apparent reason, does that workplace then owe that family compensation? I think so, right?
Yeah,
they're not protected.
This is a great question. This is the question that many of the businesses in my market are asking, and they're coming to me to do some of this internal testing to support their legal lawsuit against the city. They are saying, you have mandated a medical procedure that we now have to apply to our employees, and our employees are suffering adverse effects of this. So you have essentially created an unfunded mandate. We have to protect the health of our employees. You've pushed off all of the responsibility onto us, and you've given us no resources with which to work with. I mean, if you're the other unfunded mandate is to the individuals. I mean, if you go on Amazon right now, a mask is going to cost you about 64 cents a mask. You can buy a box of 50 for about $30. If you're using 2 masks a day, and that would be a minimum, because you should only be using them once and then throwing them away after about 30 minutes of wear, or as soon as they start to retain moisture. You're talking about adding $60 a month to every family member's to your budget. I mean, many people can't afford that. They don't have margin in their budget for that. So what are they going to do? Jack, they're going to reuse a mask. Now, reusing a mask that is designed to be maintained sterile, to be used once and thrown away, is going to increase the transmission of disease. Yeah. And I believe that if we really did the science to look at, do masks really help mitigate the transmission of this disease? And and we didn't go into it with a bias trying to demonstrate that that's what they do, you would find that masks will increase the rate of death. It will increase the rate of death because we are increasing the transmission by contaminating ourselves every time we touch the mask. I mean, all you have to do is go look, go to a Walmart or a grocery store and watch how people are wearing, how they're handling, how they're managing that mask. This is wrong in every level. They don't have the training that I had and most healthcare workers have to understand how important it is to maintain the sterility of that medical device. And they are putting those things on their face, on their forehead, their chin. They're moving them around. They get uncomfortable, and so they bring it down for a while, and they grab it right there. I've seen it. I've got videos of people doing this.
Of course.
And they're so contaminating the environment that I think we're going to create worse disease. You asked the question just a minute ago, Jack, what was, do they know this? Because they've seen the same science. Our public health authorities have seen the same science that we have.
Yep.
So if the science doesn't support what they're recommending, what is their agenda? And I think it's clear. It's not a scientific agenda. It's something else. And I can't ascribe,
I'll go there. I'll go there. They need enough patients for a clinical trial. That'll do it. Right.
Yeah.
They need to, the New England Journal of Medicine just published 6 conditions that would trigger mandates for a vaccine. One of them was that it was bad enough in the country that, we had a large enough number of people dying, a large enough caseload. So, people may understand this, but if we're looking at the risks of low CO2, your cognitive decline, low oxygen, passing out, it doesn't take much to get seriously injured if you're an adult standing upright doing nothing, right? You can hit your head.
You are, as always, Jack, you are courageous and brave and telling the truth as you see it. I see it the same way. I see that they are, in fact, using a medical intervention that they know will probably worsen the disease, because that's what the scientific studies say. So they're trying to worsen the disease, like Cuomo did when he started sending infected patients back into the nursing homes and the long-term care centers. They were doing things to make this pandemic worse. And I think that's what, this is it.
There you go. So Rand Paul, I got this right off your Facebook feed. Rand Paul calls for Cuomo to be impeached over coronavirus response. And you said something that was a little bit more severe for
I think he should be indicted. I commented on this piece this morning. I think he should be indicted for negligence and manslaughter, because and it's well documented now that in defiance of even the CDC guidelines for managing COVID-19 patients, he was taking still actively infected COVID-19 patients, trying to clear beds in the hospital because, they needed hospital capacity, right? So he's taking infected COVID-19 patients that were admitted from a nursing home, and he's sending them back into that nursing home and spreading the infection and, killing tens of thousands of New York senior citizens in that process. He defied the regulations, so he's not going to be able to fall upon CDC regulations to say, I had a reason to do this.
Right.
No, he's going to be found negligent. If he isn't charged, and he will be indicted for, I'm no lawyer, but I think he should be indicted for negligent homicide. And that's because that's what he and his health director did. And Whitmer did the same thing in Michigan. Your governor in Pennsylvania did something very similar. If you look at the statistics of case fatalities in this country, 62% of all COVID-19 case fatalities arose in 6 states that represent 18% of the U.S. population. And that's New York, Pennsylvania, New Jersey, Michigan, Minnesota, and 1 or 2 others. They're all, by the way, blue states.
Fauci says New York did it right. In other words, tell the rest of the states, whatever New York did, do that. That's what Fauci's message is, right? Whatever New York did, do that.
Fauci,
So the World Health Organization sent this task force to Africa to find out why there's so few deaths due to coronavirus. And do you know what? You know what they found?
Because they're so highly treated with hydroxychloroquine for malaria?
That's a good one, but no, not enough ventilators.
Okay.
They didn't have enough ventilators.
I got another one. vitamin D levels.
That's right. Vitamin D levels, not enough ventilators. They actually use hydroxychloroquine anyway to prevent malaria all the time. No, they didn't find that. That's a joke to say not enough ventilators, and it's a bad one, and I apologize for that. But, we've got the ability to treat this. You brought up hydroxychloroquine. Let me bring up the next little thing here that I saw.
What an interesting story.
Tell me about this. What happened today with the Yale epidemiology professor?
Yeah, so what this Yale epidemiology professor is explaining is what so many of us have been screaming from the mountaintops for so long, is that a cheap, effective, and highly effective and safe therapeutic, hydroxychloroquine, that is prescribed in hundreds of millions of people all over the world and has for many years for chronic therapy at higher doses, is being deprived. Our population in the United States and many states is being deprived and restricted from prescribing as a preventative measure, as an acute treatment measure, and as a result, more people that are not getting a safe, low-cost $40 course of therapy for 5 days with hydroxychloroquine at about 400 to 600 milligrams per day for about 5 days in conjunction with zinc and probably azithromycin. Patients are dying because they don't have access to this medication. This epidemiology professor is talking about how many lives we have lost because our doctors are believing the science fiction that was published in the Lancet. The Lancet article by Desai and colleagues that talked about 96,000 some odd patients from multiple hospitals all over the world, showed that hydroxychloroquine was harming patients. That was retracted because it was absolute fraudulent science fiction.
But yet they're still relying on it. Absolutely. I've read the policy positions on it. I've read the policy positions where they say, even though it was retracted and it may have influenced our position, we're still recommending this. It's overt. This guy's name was Dr. Harvey Reish at Yale, epidemiologist, saying you guys are killing people. These deaths could be avoided if you just let hydroxychloroquine loose on the population. Well, that's something that I don't know. When was it? February or March? I was talking about hydroxychloroquine. Dell was talking about it right. Our community was on it, saying my ideal approach to this, because the medical community was freaking out about, we have to deal with it. There's high viral loads coming at us. We need 2 weeks. I said, fine, shut down the country for 2 weeks, maybe 3. Break out the hydroxychloroquine, distribute it to the people that are at risk of exposure prophylactically. The most reasonable, rational thing I could think of. And then in-home private testing so the state doesn't get involved. If you want to test, test. If you want to mask. If you want to vaccinate, whatever. We need this kind of, science-based, so people can figure out for themselves. We live in one of the most educated populations. We pump billions of dollars into public education every year as a population. We're not stupid, okay?
Right.
So what I'd like to do is have everybody think about, if you're forced to wear a mask and you're in compliance to keep your job, try educating your employer about their liabilities. Educate your employer about the fact that they don't have protection, about the CO2 risk, and about the fact that they probably want to just turn a blind eye if somebody doesn't want to, induce CO2 toxicity in their body on the workplace. That's what I think we ought to do.
Well,
we ought to have this.
I'd like to dig into this hydroxychloroquine thing real quick and really show the pattern of behavior of the pharmaceutical industry and what they do to assassinate a low-cost therapeutic that threatens their market. If you want to see how fraud in science is being perpetrated, watch what happened with hydroxychloroquine. You had 2 preprint articles that were first published. One was the Lancet study that I just talked about, completely fraud, retracted. Before that, you had the VA study. It was funded by 3 scientists that were funded by Gilead Sciences, one of the competitors that makes remdesivir.
Yep.
And it was crap science. But the problem that we have with these preprint publications is it allows fraudulent science to get halfway around the world, the lie. of some of these fraudulent science studies to get halfway around the world before the truth gets out of the gate. And that's what was happening. You had these two pieces of fraud that were widely published by the mainstream media that completely assassinated the whole idea that hydroxychloroquine was effective in the treatment of COVID-19. You then had the solidarity and the recovery trials that were not only fraud, they were studies that were designed to fail, and they were designed to kill the patients. They were treating the patients in those two studies, and the protocol was designed by a panel from the World Health Organization, upon which sat 3 members of the Gates Foundation and multiple members of industry to create a protocol that was 5 to 6 times the therapeutic dose for hydroxychloroquine.
Toxic.
In a toxic dose. And they were treating these patients with a toxic dose that we already knew from a Brazil study in which 1,200 milligrams had been used. And they found that there was enough toxicity there that they stopped that arm of the study, and the 400 to 600 milligram arm of that study was showing efficacy and significant improvement. We already had the science, Jack. We had the science that said we shouldn't be going above that therapeutic dose. It works. We don't really need to test that. But what they did in the Solidarity and the UK recovery trial is they designed studies that were designed to fail so that they could put another nail in the HCQ coffin, because
they treated late stage. They treated late stage COVID-19 as well,
and they were treating it late stage too. Yes, I mean, hydroxychloroquine should be used early. These interventions should be used early. Sure. But the other part of this study that I don't think just needs to be spoken, not studies, but this problem in the pandemic is not only are we not treating early, Jack, but we are allowing patients to decompensate in hospitals, going to ventilators. Because why? Because there's an incentive for the hospitals to do so. They want to bring people in, diagnose them with COVID-19, get $13,000 bonus for doing so. And if they decompensate and they have to go to ventilator, that's another 39 grand in the pocket of the hospital. Charlie Munger said, show me an incentive and I'll show you an outcome. In medicine, that is absolutely true.
Charlie Munger said that. Charlie Munger said, show me an incentive, I'll show you an outcome in medicine.
That's right.
James Lyons Weiler said, capitalism and medicine do not mix. In my book, Cures versus Profits, this is a problem that we anticipated, but not as, let me pull this out. This is not a commercial, but Cures versus Profits. This is a beautiful, thick book. I'm going to send you a copy, Jim, if you haven't read it.
Oh, I'd love it. Yeah. And I don't have that one.
There's got 16 chapters, and it goes over, at the time, all of the profiteering going on with price fixing. The Gilead remdesivir, last I checked, was $3,100 a dose.
That's right.
And American citizens paying twice that from what other countries were paying, whereas hydroxychloroquine is what, $1.50, maybe?
$40 for $40. Budesonide is about $237, which is another therapeutic, low-cost therapeutic as a nebulized steroid. We have so many therapeutics now that could halt the progression of this disease.
Yeah.
But I'll tell you, I had an interaction. I'll give you a real life story. Interaction with a colleague here in Tulsa, Oklahoma, who told me in a debate we were having on Facebook that she had 21 patients with COVID-19 on ventilators in Tulsa, Oklahoma. She did not believe in hydroxychloroquine. She thought it was dangerous. She was still lost in that, science fiction of the Lancet studies and others. She was completely uneducated in the real science. And so she was, and she had reported that 6 of her patients had already died. And my only response, which was a harsh one, but it was a reality, was you are responsible for about 1% of the deaths in Oklahoma because you have the wrong science. You are applying the wrong medicine. Your patients are dying because you are ignorant of the science. So it's a reality. So how many of these patients that are dying in hospitals are dying because they're not getting the right therapeutics, because they're not getting them early enough? And that's, I think, what's really a travesty is the response in the medical system to this disease process has been negligent, and we need to fix that. I think that's just the biggest problem. I mean, if you look at one day, we might know the truth about what was happening in New York City. I think Erin Marie, the nurse that volunteered to serve at the front lines in New York City at Elmhurst Hospital, told us a dark truth about what she experienced there. Yeah. And I think that truth is playing itself out.
And what you're talking about there, for people that are not aware, is that people were given do not resuscitate, DNR treatment when they didn't have it on file, and they didn't even call the family. So that's murder. That's murder right there.
Yeah, it is. Yeah.
So you know about the Brownstein study that was published in Science, Public Health Policy and the Law. Let me play something. It's a short little thing from Newsmax. Nobody in our community's seen it, but I'm going to play it here.
Hey folks, welcome back to American Agenda. Some breaking news right now. We've got a Quinnipiac University poll. The university just released a new poll showing a very tight race in Texas. In fact, President Trump is behind Democratic nominee Joe Biden by just 1 point. He's behind Biden. So Biden leading. This is the latest in a series of disappointing poll numbers for the president. Texas has voted Republican going back quite some time, for decades, in fact. And it's you always hear how Texas as a state may go blue, and it never does. Since 1980, they've been voting for a Republican. But right now, and again, I would believe this only when I saw it on Election Day, or however long it takes to get the actual results, but Biden ahead by 1 point there in the Lone Star State. Okay, elsewhere, a stern warning from Dr. Chauncey Crandall about the rise of coronavirus cases and hospitalizations, specifically in Florida.
Here I am at the emergency room, and this place is loaded with COVID patients. It's ridiculous.
Close your mask.
And look what they brought in today. We've got a big container here. All the patients are coming into this container. It reminds me of when I was in Haiti with the cholera outbreak. There are no beds, there are no ICU beds, there are no ventilators. We're in full-blown disaster mode here, and I believe we're going to need more help in Florida. At this moment, it's just crazy.
Dr. Crandall, cardiologist in West Palm Beach area and author of the book Fight Back, which is about how you can beat coronavirus and avoid infection. This comes as scientists are desperately trying to figure out exactly how the virus spreads. Perhaps the most anticipated item to come out of all the coronavirus research is the development of a vaccine, of course. And the U.S. announced today it has reached a $2 billion deal with Pfizer and BioNTech. That's a European company, to acquire 100 million doses of their vaccine candidate. So does this mean we're getting close to the end of all this? To weigh in, we welcome family physician and director of the Center for Holistic Medicine in Michigan, Dr. David Brownstein. Now, Dr. Brownstein, I understand you also recently published a study about treating coronavirus patients with nutritional and oxidative therapies. Can you talk about that for a moment?
Sure. We treated 107 patients in my office. We have an office outside of Detroit, so we were in a hot spot when it started in March. And we were overloaded with corona, just like everybody else in the Detroit area. And we used a therapy that we've been using for over 20 years for treating flu and other influenza-like illnesses. And when COVID was making its way across the country from the West Coast to the East Coast, I had a meeting with my staff about a week before it hit. And I said, I think we'll have this thing covered. We've been practicing medicine for over 20 years, and we've been practicing for a condition just like this. Our therapies have worked for other virus infections for our patients. Our patients don't get pneumonia. Our patients don't die from flu and flu-like illnesses. And I expected when coronavirus hit that our patients would do well. And I was elated and surprised and happy, and they did do well, just like they've done over the last 20 years. And our approach consisted of using vitamins A, C, D, and iodine, and then hydrogen peroxide, and ozone, and intravenous vitamin C. And you know, we had 107 patients we treated with it. One was hospitalized. There were no ventilators and no deaths in our population.
Wow, that's amazing. Now, that's preventative. We do see that people do get it. We're trying to eliminate that. So what you know of the Pfizer vaccine, does this look good to you? And are there some other vaccine candidates out there that you think are promising?
I'm not quite sure why the U.S. government is spending $1 billion without knowing that it's going to work in advance like this. There's enough companies working on the vaccine. I think we should wait it out and see what comes to the top. So I hope there's a safe and effective vaccine, but we need to keep in mind there was a coronavirus vaccine a few years ago that didn't do so well in the animal testing studies. All the animals who got the vaccine got the virus, and many of them, I think they all died. So we're skipping that step in this round because we're warp speeding it. So I think the government would be better to wait it out and see what happens with it. But people are dying right now. They're sick right now. Just as you saw Dr. Crandall say, the ERs are overflowed in Florida. We need therapies that can help build people up. I never said the therapy I was doing treated coronavirus. I just said it supports the immune system, and I expected it to treat this viral infection just like it's treated every other viral infection we've treated over the last 20 years. And it did. And that's what we should be focusing our energy on right now.
Fair enough. Thank you. Dr. David Brownstein talking with us there. Coming up.
Oh, there you go. So you read the study, right? You read Dr. Brownstein's study, right?
Yeah. And Dr. David Brownstein is one of those other brilliant minds out there that is thinking outside of the box, is reading more than the pharmaceutical pamphlets that so many of our colleagues read. He's preventing the disease. He's treating it in its early stages, and the results of his outcome very similar to those of Dr. Zelenko and Dr. Didier Raoult. So many other physicians out there that have found therapeutics to put out the fires of the cytokine storm, to support the health of the immune system. And what these doctors are showing, and yet they're, something like what he's talking about will be censored on social media. I guarantee you it is all the time. You start talking about vitamin D and vitamin C as a, immune support and possible treatment for COVID-19, censored. It will be shut down, and you'll be marked as a misinformation purveyor.
Agreed. And so here's the journal where the study appears. I'm the editor-in-chief of Science, Public Health Policy, and the Law. I put this study through the ringer. There were 3 independent physicians that reviewed it. There was one informed citizen, representative of the human population that receives medicine. And there's an editorial that I wrote, and the treatment itself. So if you go to Science, Public Health Policy, and the Law, then you can actually, this won't load the PDF. Yeah, well, there it is. So you can actually see and read it and send it to that doctor in Florida needs to receive this study, because if they have just this study, he can relax, he can order the components. It's not a complicated procedure. They can treat people in the parking lot like Dr. Brownstein and his team did and does. So I know you got a jet. You've got some important business to attend to. I want to give you some time to close out about, we need to know, the people need to know, what can we do to really have the most massive impact? I already said that they need to talk to their employers and educate their employers. What do you think people can do now with the knowledge that they've gotten and all that we've communicated, everything we've talked about? What can people start doing now?
Well, we started talking about masks. So you should know that if you're going to wear a mask, I personally don't recommend it. I don't wear it unless you're caring for someone that has COVID-19. Healthy people should not wear masks. But if you are going to wear one, if you are so fearful that you believe that you should, then you got to wear it properly. You got to wear it for a short period of time, dispose of it. Don't reuse it. When it becomes wet with moisture, you need to get rid of it. If you feel like you're coming down with something, get the mask off your face, quarantine, stay home, wash your hands, socially distance. If you have the disease, stay home. Don't wear a mask out in the public because it won't block the virus. The virus will pass through that like a mosquito through a chain link fence. You're not going to do anybody any good. We talked about, prevention. Know that there are low cost, safe, and effective therapeutics out there. Hydroxychloroquine plus zinc plus or minus azithromycin is a lifesaver, used early and effectively. Dr. Brownstein's therapeutics in 107 patients definitely shows that these low-cost immune supports, vitamin A, vitamin D, vitamin C, iodine, zinc, these therapeutics can save your life. They can also be used preventatively, prophylactically. You could be taking all of the items in that protocol. You could go down to your health food store today and start getting those. You could also just go out and get some sun to increase your vitamin D levels, and you have more control over your health. Don't wear a mask and become fearful. You know, by that, I mean, listen to that doctor. He's almost manic. He's almost, there's this fear. His oxygen is being lowered. His CO2 is being rebreathed, and it's putting him in a state of anxiety and fear. That's the unintended consequence or intended consequence of wearing a mask for extended periods of time. It will make you less. It will make you fearful, and it'll make you do things and say things and not read things and not acknowledge science to a point where it'll cost you your life.
Totally. So listen, people, that's Dr. Jim Meehan. We're going to have you back again as soon as possible to keep tabs on what's going on with respect to this fight for, the discord between OSHA's policies on masking and OSHA's policies on CO2. I think that's a very, very important thing. People need to act on it. Don't sit back. This is not a spectator sport that you're in. This is your life. But I'm going to ask them to also please get this study, download it. It's free online. The public paid for the publication of this. Send it to your doctors, send it to your schools, send it to anybody that is a human being. Send it out to everybody, because if we know that we can take care of this in a way that allows people to develop immunity and not get so sick, why the hell wouldn't we do that first?
Right.
It only makes sense. Well, listen, it's been a pleasure talking with you again. You're, like I said, a good person, a very good man. Say hello to the missus for me. And
will do, Jack.
Right on.
God bless you. Thanks for getting the truth out. Thank you for unbreaking science, Jack.
Yeah, will do. Thank you so much. Keep at it. So here we go. I'm going to leave this up on the way out. And thanks again. Catch us in a couple of days. We're going to come back with more information on coronavirus and vaccines, aluminum, and so on. Thank you.